to our basically bi-weekly community meetings. And today we are going to talk about family supports, and we will do a brief presentation, and then we will go into questions, and we primarily do the questions through typing into the chat. And for those of you who are getting Spanish interpretation, we will get your questions typed into the chat as well and translated if you need that. So my name is Lisa Kleinbaum, and I'm the Executive Director here at Regional Center of the East Bay. And today myself and Ronke Sodipo, who is the Director of Consumer Services at Regional Center of the East Bay, will be talking with you and sharing a presentation with you. So I'm going to start with sharing my screen, and let's see.
May I just ask Jairo to unmute yourself?
Okay. So I want okay, it's weirdly it stopped my screen sharing for a minute. So I wanted to share with you first the current statistics on COVID-19. And as of the 12th, which is 2 days ago, we know of 66 positive cases in our area and 2 people who have died. And of this number, 13 are people residing with their family. And because most of the people that we serve, about 81%, live with their families, we do think the number of people who've tested positive with COVID-19 living with their families is fairly low. And that may be actual numbers, but I do want to encourage you, if that you live with a family member who's a Regional Center client, or if you're a Regional Center client and test positive with COVID, please let your case manager know. The Department of Developmental Services is interested in getting these reports, and when we find out that someone has tested positive, we are able to support you by bringing protective equipment out that can help caregivers to work with someone who tests positive. So we encourage you to let us know about that. Right now in our counties, we continue to be under shelter in place with the requirements of masks and face coverings, hand washing, and physical distancing. Since we continue on the county watch list of the state, shelter in place isn't going to end until COVID-19 cases have declined to a point where we are off the watch list for 14 days. And while cases decline, we remain on the watch list until they decline for 14 days, and then there's another additional 14 days off the list. So this is probably at least another couple of months away until some additional restrictions will be lifted. And that is the reality right now. And we are making as many adjustments as we can to cope with that. For adults, almost all non-residential site-based programs continue to be closed. And the process for really re-entering is on pause due to the county restrictions. And so we still are not able to have day service providers reopen sites. Our providers have been paid for non-residential services during this time, and those payments for non-residential services are going to end at the end of August, and a new framework will start. And that new framework will be done by discussions with individuals and families, and look at what services a provider is able to provide to people during shelter in place and what they want. If people have been getting remote service delivery, Zoom and other sorts of remote services, supplies being brought to your house, direct services in your home, those will also continue. But our providers are going to have to change a little bit how they're providing information about their service delivery as we move forward. Direct services to individuals in their home, opening of programs really have to be done with the guidance of the counties, and so it will be different depending on what county people are in and where they're at in terms of reopening. We are encouraging people looking at things like outdoor activities. If a couple of people can meet outside, separated by 6 feet, get exercise, those kind of things. We're really hoping those kind of things can resume for people. And I'll talk about one more directive that we have from the state right now, and then I'll turn over the next slide to Ronke. Right now, the Department of Developmental Services, who we contract with, issued a directive that regional centers must ensure that people who have compromised immune systems or who are more susceptible to respiratory illness, as well as those who reside in some of our specialized medical homes, need to remain home rather than attend day services outside the home. Now, if someone has a disagreement with this, we certainly will be able to work with you on that and look at what is appropriate for that particular situation. Now I'm going to turn things over to Ronke Sodipo to talk about other family supports that we are providing right now and how we do that.
Hello, everyone. I'm going to focus, I think a couple of meetings ago, we did focus on respite, but right now I do want to just touch on each one of these: respite, specialized childcare, as well as additional participant-directed services, which actually was initiated during this shelter-in-place season. So for specialized daycare, as usual, it's in-home or out-of-home support for childcare or daycare for working parents, for when a parent is working or is involved in school or some sort of college or educational pursuit. And Regional Center also, when the care and supervision of the individual we serve is beyond that would be required by parents of a non-disabled peer of the same age, then Regional Center does offer specialized child care. And generally what we need from families would be proof of employment. And we know that right now, generally in the past, before COVID-19, before all that's been going on recently, it was generally when parents were working outside of the home. But we know that we are altering our policy on that because we do know that majority of individuals are working from home or working remotely. So therefore just proof of work and that the work is provided either for individuals who are working outside the home still, or that it's been provided and you're working remotely, proof of that, and proof of for parents or family members who are working or going to school or college. Sometimes we do need that schedule or something to prove that that's what's going on. So those same services continue. but we know that they're needing to be provided in a slightly different way than before. And so I'll talk about how folks should communicate with your case managers to talk about how that might be different for you. For children, we know that a lot of schools are starting up again, but they're only providing remote services for children in special education. Excuse me. And so the regulations still remain that the local school district is responsible for instruction and access to instruction for the individuals during those times, for materials and devices. Over the summer and before school started at our regional center, we have, for those families who've needed it or had access to childcare or daycare services during the time that the schools would ordinarily be closed. So that will continue until school starts, but after that we would need to have conversation about what the school's responsibilities are regarding that. Respite is also a service that is provided generally in-home, but also there are out-of-home respite opportunities at times. For the time being, out-of-home respite opportunities in residential homes is very limited and not encouraged, only because of the risk of COVID and all the things that pertain to that. For placements into our residential homes, we are watching that very carefully as individuals go in and out of those homes, the staff that go in and out. And so out-of-home respite options, we realize, are not as available right now because for individuals who maybe use that, or oftentimes, especially during this past summer, we really felt it. I know that a lot of our families felt it because of the closure of the camps, the out-of-home respite options that were available. But in-home respite options continue to be available as you as a family member, as you're able to find workers. And of course, we went over this a while back, but respite is provided when the care needs of the consumer are greater than those of a non-disabled peer. And it's to relieve you as a family member from the constant demanding responsibilities of caring for that individual. During this,
al usuario. Una de las directivas que hemos recibido del
shelter in place orders were enacted is that their DDS is waiving the requirement for in-home respite workers to have first aid and CPR, which is one of the main requirements. They're waiving it when the consumer receiving the respite services does not have a chronic or presenting health concern. So when there are no real significant health concerns, then that requirement is waived. And generally, respite agencies are aware of that and will be informing the individuals or the families about that. Another thing that is waived during this time, thankfully, are family fees. So generally for respite and for specialized childcare or daycare, we would be regional centers are mandated to take a look at the family's income and to assess a family cost participation. And as of March 12th, this is waived. So for any new or reauthorizations, any new purchase of service that we're doing for childcare respite, or any reauthorizations that we're doing, FCPP, the Family Cost Participation Program, is waived. So we're waiving that. The other waiver has to do with the AFPF, the family program fee, additional family program fee that we assessed during this time. So since March, and I believe it's extended through sometime in September so far. And what the department has been doing is that they are extending these sometimes, 30 days at a time. So we recently, I think as of last Friday, we did get an extension on that through September. So we are currently not assessing any family fees as we get to reauthorizing specialized childcare, daycare, and respite services. In the midst of this, one of the services that was added because of the need for families to be able to find other resources to meet the needs in the home. We have added, the department added additional participant-directed services, and specifically for personal assistance, for independent living services or supported employment services. And essentially what this was recognition that even though families might have respite workers through an agency or the other individuals, because of the risk of bringing other people into our homes, that may be a little bit problematic in terms of the spread of COVID. So for that reason, a family can find an individual, must be 18 years or older, must be able to perform the service. So if it's specifically for independent living services, for instance, they still would need to be able to teach these independent living skills and those kinds of meet that criteria, or if for personal assistance that they would be able to perform the service. But it can be somebody who's other than the parent or a spouse of the individual that we serve. So consumer's parent or spouse cannot provide the service, but it could be what we found ways that some families have used this is a sibling, an older sibling, college student who's home, who's doing remote learning right now, can be the personal assistant or the ILS, the independent living skills instructor for their sibling, or a grandmother or a neighbor that you feel comfortable with. The only requirement besides these are that we go through, just much like the employer of record respite services that some might be used to, this needs to go through a fiscal management services agency, and we have 2 vendored already for fiscal management services specific to providing personal assistance and independent living skills training, as well as supported employment like a job coach service. So this is something that is new for us to be able to use in this way for individuals to avail themselves of people you are more familiar with, you're comfortable with, you know they're COVID tested, you know they're negative, you know that it would be okay for them to come into the home to provide personal assistance services or independent living skills training. And supported employment, I haven't heard of a whole lot of that, but that also could be used for supported employment. And I just wanted to say that for all of these things, in recognition of the fact that we are in a very different time period than we've had before. As usual, please go through your case managers to ask for an individual program plan meeting or a meeting to discuss these services. There are a lot of different scenarios. We recognize not every family is the same. There's so many different scenarios and things that we have to take into consideration in recognizing what to do. So please use the IPP process. Contact your case manager if you need to avail yourself or look at something a little differently than we have before. And then we also wanted to talk for our early start, our babies, young toddlers in the Early Start program. We did receive directives related to the educational process. So as the babies and toddlers reach their 3rd birthday, and initially and thankfully, we know that a lot of the school districts are now really up and running, and we can engage them. But for a while there, we were not able to engage the local education agencies. So there is a directive that RCB can extend early start services for periods of time, and we'll continue to work with a family in transition. We do this, and this is for services for individuals who are already being served by RCEB, who are already receiving services funded and are turning 3 within this period of time. Right now, the extension is through sometime, I believe it's September 13th, but that would be to extend the services that we're already funding if there's a delay in getting the individual through to the school district. Okay, so the same process would be to contact the case manager and to, through the IFSP process, contact the case manager and to talk about what the options are. One of the things that we must do is make sure that we are making these referrals to the local education agencies and that they're being responsive, and we're helping our families to advocate with them, with the school districts, to be responsive. But if then after all that is done and there still is no movement, then we can talk with the case manager about extending while we're waiting. And that's it for me.
And I'm going to take over just our last slide here. Looking to the future, I want to talk about three things. As one thinks about reentry, going back into community services, more congregate services, keep in mind that we all have to assess our individual risk and benefits to participating. So for many individuals who are fairly healthy and who can wear a mask, can wear a face covering, there may be choices made to go back into more congregate settings sooner because the benefits of being with others, having that kind of social emotional support are very important, and people can follow the guidance around that. For others, as we see in the directive on people with chronic conditions, the risk may be high enough that re-entry will be delayed for quite some time. And those are all very individualized decisions and may be made both on an individual basis, a family basis. We know that some people who attend our day services have family members at home that are at high risk. So there is a lot that goes into decision making. The second thing I want to talk about is flu shots. The seasonal flu shots come out about this time every year. We should be seeing widespread availability by mid-September. And the Centers for Disease Control are encouraging everyone who possibly can to get a flu shot this year. The reason for that is the symptoms of COVID-19 are very similar to the symptoms of the seasonal flu. And so if people have flu shots, we expect there will be fewer people getting the seasonal flu and filling up hospital beds that may be needed for people with COVID-19 for which there is not currently a vaccination. So it also is something that every year we would advise to get for almost all individuals except those who it's a high risk for. The final thing is vaccinations. We expect that sometime early next year, there will be vaccinations available for COVID-19. That is what we are hearing from the CDC. We don't know when that is. We will work with our state partners to assure that there will be adequate resources for people who are served by the regional centers to get vaccinated, especially considering those who are very fragile and for whom the vaccination would be very important to present other severe outcomes. So I just wanted to let you know about those three things as we look towards the future. Right now, the things we can start to plan for are thinking through the questions of re-entry and flu shots. Vaccinations are a little further on the horizon. So I'm going to stop sharing here, and I'm going to go into the chat, and both Ronke and I will be able to, to go on with the questions. So let me start with, I know that we had a little glitch on advancing the PowerPoint slides, so we will post those. Again, there is a question, how can we get a list of respite agencies? Ronke?
Feel free to ask. We're trying to make our website more user-friendly. They are listed on our website. However, feel free to contact your case manager to give you a list. Some of our most of our respite agencies serve both counties, so a full list should be available to you if you'd like it.
And then I have someone saying, I'm waiting for agency and they are taking too long for respite services. Ronke, do you want to?
Yeah, I'd like to, please contact me, because what we need to find out is I'm not quite sure what exactly, are they hiring somebody for you? Do you have a worker to sign up with them? Many of our respite agencies do what we call employer of record, where you find the worker, your worker signs up with them, and the funding flows to the agency, and then they pay your worker. And then we have what we just call the regular respite, where they hire a worker for you. So it all depends on what it is that's going on.
And then I have a question from a day program about in-person services. Are you saying this is not allowed under any circumstances? No, in-person services are allowed for people who family members are interested in having those services provided. And also if there is someone who is working and getting job coaching, respite workers are providing respite at this time directly with proper personal protective equipment. But congregate settings, which are where many of our day programs take place, are settings where there is a group of one consumer, one staff person to 3 or 6 consumers, are really not occurring right now, because many of those take place indoors where social distancing is not possible. And many of those take place serving people who are not able to wear a mask at all times, thus posing a risk if someone was positive for COVID-19. So a lot of the in-person services right now are taking place on an individualized basis when that is key to the person's health and safety. Remember that most people who are living in supported living and with their families and in other settings, residential settings, are getting in-person services. The goal right now is to minimize the number of contacts people have and opportunities for people to transmit the virus. Another question, how do you define personal assistance services? Can you give an example of the activities provided? And can personal assistance services to be used to assist consumers in attending Zoom services provided by the day program? Ronke, do you want to?
Yes, I actually was trying to find the Title 17 description, but generally personal assistance is somewhat beyond just care and supervision, but it may involve providing some personal care, like feeding an individual or helping to bathe them, or more personal than just supervision, oversight, and doing activities with an individual. But there is a description in Title 17 that I was trying to find real quick for you, but it's usually providing a little bit more physical assistance to an individual than just general overview or general care and supervision. And what was the other question about? Give examples?
Yeah.
Some of the families who've asked for personal assistance, it has been for individuals maybe who are not so mobile, who need to be fed, who need some assistance maybe with some of their personal hygiene. It's beyond just supervising or doing a work activity with the individual. Those are the individuals who've asked for personal assistance support.
But if someone were working outside the home and they had an individual that was their family member living in the home, they could use daycare services, and daycare services would be able to help someone participate in Zoom classes. Is that correct, Ronke?
Yes.
Yeah, okay. And what's the pay rate for providers under participant-directed services?
I believe I have it right here, so let me find it for you. It is, I believe it's $22 to the FMS. The amount they pay, let me find it real quick. Maybe let's go to another question, then I'll come back to it.
Okay,
I have it on my
so
desk.
the next question is, are we going to implement the self-determination program in 2021? My brother was not chosen in the first group. We believe we are working with all of the people who were chosen in the first and second selection to develop their plans and budgets, and they are moving through the process. There is a little unclarity on the exact date that the program will be rolled out to everyone. The pilot was supposed to be 3 years, which would mean that the program should roll out to everyone in June or July of 2021. However, we are still waiting for a firm commitment on that from the Department of Developmental Services. Ronke, did you get an answer?
I do, yeah. So it's $22.80 per hour to the FMS, the Fiscal Management Agency, the employee wage of no less than $16.25 per hour. And there's 22% of employee wages, but the wage that goes directly to the worker should be no less than $16.25.
Okay, and I see Ronke, Ronke's answer was translated by Etta in the chat.
Oh, okay.
Yeah, yeah. Are there any other questions from our attendees? We're happy to, I saw 2 questions here. What documentation is required to provide services to consumers to attend classes provided by day programs when they cannot attend day program in person? So maybe if you could clarify, do you mean what documentation is the day program required to provide, or what documentation is the individual who's attending those classes required to maintain? I'm a little confused by that, but if you could answer that. I also saw another question is, what type of assessments and for what ages is the Regional Center doing virtual assessments? So in terms of virtual assessments as well as virtual IPP and IFSP meetings, we have been given permission in a number of directives to continue those services remotely. We are doing Early Start, which are for our under 3 kids, remote assessments, and almost all of the assessors who typically do assessments are conducting those remotely for children and families. There are probably a couple of assessors who are actually doing direct assessments with appropriate personal protective equipment. For our assessments that take place for that are psychological testing for our status 2 services, there are some assessments that are taking place remotely. Many of the assessments that are for those between the ages of 3 and 6 or 7 rely a lot on materials that really have to be done directly, and a lot of the tests are not standardized to work with someone remotely. So the department has given us the option to, when we believe that there is a high possibility that the individual who has applied for intake has a developmental disability, we have the ability to do presumptive eligibility, which allows for the person to be made eligible. However, we will be able to go back and do further testing in order to make a permanent decision when the pandemic is over. So those are the 2 kinds of things. Let's see. documentation in order to qualify for this service. So if someone was receiving services prior from a day service, then they would be able to continue with the alternative method, Zoom, and so forth. If they have not been receiving a service or they want to change service providers to another service provider, they should work through their case manager, because certainly if someone wants a different day service or different services to happen, we would like to help you with that. So that is something that you would need updated IPP, and you would need an updated authorization as well. So that is what we would have to do. How can an individual be a personal assistance provider? Ronke, do you want to?
Sure. Generally, the family, you would need to sign up with the family member, with the family of an individual we serve to be a personal assistance provider, and then they would send you to the fiscal management service that they have selected. I think the only other way I can think of is if an individual contact an FMS and at least let them know that they are available to provide a service, so that as families need someone, they might be able to utilize them.
There's a question here, will you have a monthly Zoom event for the clients, not just for the care providers like parents, in the near future? I would like to encourage anyone who is a regional center of the East Bay consumer to look on our website, and we can certainly highlight that a little bit more on our website. Every month, our Consumer Advisory Committee meets. It is on the second Monday of each month at 4 p.m. And we meet via Zoom right now, and that is a meeting where individuals served can participate and share both their concerns and also give input on policy. And so we would really like people served to join those meetings. And there are some people who are members. They've attended a number of the CAC meetings. Others can just participate and listen in. And those meetings, we generally share information that I'm sharing today and talk about things that are important. And I see that we have put the web link to our CAC meetings, and the CAC participants really welcome new people joining and participating in that. You mentioned 2 FMSs for personal assistance service, and it looks like people know about ARCC. Are there others?
Premier Health is the other. Those are the 2 that are vendored with our regional center.
And they are a statewide vendorization generally. So if there is a FMS vendored for this service elsewhere, we can work with another regional center to do what we call courtesy vendor them for our area, but that takes a little while. It took a little while when we first were allowed to use this service to get it up and running, because it's a process to move vendorization from one regional center to another. But, okay. I see there's a comment that someone was attending the service before and someone wants all sorts of documentation to continue the service remotely via Zoom. If you could, in the chat, leave us your email and we will get back to you on that, because that's a more individualized detail that we would like to work on. And no, ARCC isn't the only one at this time. There is one other, Premier, and there are others across the state as well. People just haven't asked to work with those ones yet. When will case managers resume their in-person home visits? Okay, since you are in charge of case management.
We are wading through when that would make sense. We're concerned for the well-being of our families, of the individuals we serve, because we have to kind of be able to figure out each person's possible risk. Everybody's coming from different families, and then going into homes and all of those. So for right now, we are not encouraging it until we have a better sense of the risk factors and those kinds of things before we want individuals going into homes.
Yeah. I mean, it is of concern to us that for any kind of visiting that people would go to more than one home and be exposed and not know, and we see so many asymptomatic situations. We are encouraging our case managers to use Zoom for meetings, and if that is something that your case manager hasn't offered and you want, please ask them for that. We do schedule meetings that way all the time, and we will work with you on that. Our case managers, I'll just share with you, we meet with a group of our case managers every other week, and one of their concerns and one of the things that they really missed was being able to visit with the people they serve and to have those meetings and to have those personal contacts. And so it is certainly something that people really are feeling that they miss. I think we'll first probably start with more things like if someone has a large backyard and people could do a meeting that was socially distanced or saying hello and those sorts of things. Those may be things we start with just to keep everyone safe. Let's see. There's one question in Spanish.
She said she answered already. Eva answered.
Okay, so that's the one. If there's a question of any help for infections, the last one.
With
Yeah, okay. Thank you. So we'll wait another minute for any other questions that people have, or if you want to share what topics you would like to hear on a community meeting, we'd like to respond to you. We will be in the next month or so, we will have some meetings related to our annual performance contract that are usually our public meetings, and so we may do one of those on a Friday so people can participate in that. So we're trying to think of ways we can share you information. I think as soon as we have the new day program framework, we will certainly have that as a presentation. Okay, here I get it to translate. Does RCB offer any help for people that were infected with COVID-19? So if someone resides in supported living and in residential care homes, we are supporting those homes in a number of ways, including supporting the protective equipment for staff, providing some extra support if people are having to work just one staff working individually with one consumer so that they're not transmitting between consumers. So we are providing support for different types of pay for them so that they can work overtime and not have 5 or 6 staff exposed to one person who has COVID-19. The other things, when someone is infected in the family home or living on their own, we are also providing supports with the protective equipment. And it is also something that I think we're going to see more of if people are trying to all as a family isolate at home. That will and should be something that our day program providers or respite providers can help with getting supplies and that sort of thing in those situations. So we would like to do that. Let's see. And we will try to get more information posted on the other FMSs. Ronke, there's a question on a disparity in how engaged case managers are with their clients, any policies, professional development to standardize the quality of case management services clients receive. Do you want to?
Yes, I would like to speak with this individual. Maybe if you can leave your email. We do have standardized trainings and for our case managers and ongoing trainings and expectations. And so when there are disparities, I would like to know about them just so that we can address them. Is it because of their understanding of maybe a policy or procedure, or is it specifically related to this time that we're in the shelter in place? So I'd like to speak with you, if you don't mind leaving your information privately for me. That would be great. Thank you.
Okay.
And for the individual who wanted the information on the other FMS agency, we can provide you if you provide your information, we can provide you the contact information for Premier Health.
And during the time of COVID, we have been continuing our case management training and continuing to follow up on training both our existing and new case managers. I think that it's been a challenge for all of us to learn to do some of these things remotely. And so any feedback or information you can share with us, we really appreciate it. We're not in every meeting all the time, so that kind of feedback is important. The other thing is that after an IPP, we do send out a form, which is a consumer satisfaction survey. So please complete that as well with both positive feedback and any concerns you have. It really does inform us. Yeah. Okay. And then we do have a case manager here asking about delivering PPE to families in the community. And we do have case managers who've been leaving PPE on the front steps of families' homes. And we've had actually some family members drop by our office to pick up PPE. As long as we're socially distanced, we can certainly do that. Yeah. Thank you, Charisse, for your comments in the email, and we'll follow up on some of those things. Yeah.
Mm-hmm.
Yeah.
Yeah.
Okay. Well, thank you, everyone, and feel free to email or write to us, and we can figure out topics for other meetings, and look forward to talking with you again. Thank you.
Thank you all.
Yeah.